It's my pleasure this evening to introduce here in just a moment our speaker, Anja Shirley, RDH. Anja is a practicing hygienist out of the Portland, Oregon area. She's been a clinical hygienist for 18 plus years, is a member of the BioLays RDH team and also the Aligned Technology RDH faculty. Anja is particularly interested in the oral systemic link and spends quite a bit of her time researching better ways to treat patients and create better patient outcomes. We're very, very pleased that Anja was able to spend some time with us this evening talking about diode usage in the hygiene practice and specifically the new Epic Hygiene diode. Anja, we're very, very pleased that you're able to join us tonight. And with that being said, I'll turn over control to you and you can begin the presentation.
Awesome. Thank you so much, David. And thank all of you for joining me tonight. Thank you for the gift of your precious time. I'm so excited to share with you a lot of information about diode lasers and how they've completely changed my practice in dentistry. Okay. So today I'd like to talk to you about some of the clinical benefits of incorporating lasers in dental hygiene. So we know that this is absolutely cutting edge technology. The lasers have been around for over 20 years. It used to be more of a specialist therapy. I remember referring my patients out for some periodontal work and they would return to me with just beautiful pale pink tissue and unfathomable pocket depth reductions that would last. So we knew we were getting results and I just wondered, why can't I have that opportunity? What if there was something I could do to get these types of results for my patients? So it's just a wonderful thing that as dentistry is advanced, we're now able to just incorporate this right into our own operatories on a daily basis. And it really, truly lends our patients an endless list of benefits, and we're going to receive those benefits as well, not to mention the income and overall health of the practice. So this is truly an invaluable, multifaceted tool we have in our armamentariums. It vastly expands the ways we can serve our patients. What I love about laser therapy is it truly is minimally invasive. The AAP guidelines emphasize that periodontal health should be achieved in the least invasive and most cost-effective manner to the patient. So with laser therapy, we are precisely targeting that diseased tissue. We know these bacteria are brutal. We're all fighting the same battle against these gram-negative bacteria. They're smart, they're virulent, they are dedicated to thriving and penetrating into the tissue and colonizing. So the beautiful thing about diode lasers is that they can also penetrate that tissue. They can seek out those gram-negative bacteria and destroy them without damaging the surrounding tissues. And to me, that's just incredible that we have this method rather than we're left with our scalers and ultrasonics and antibiotics and all the other things patients don't embrace as much. So through this therapy, we're able to treat, manage, and actually reverse gum disease, eliminating the need for those painful, costly surgical procedures and referrals out to the periodontal offices. Really and truly enhancing our patient experiences. If there is one thing that I am the most protective about is my patient experience. In my operatory, I look at it as a sanctuary where I can really truly connect with my patients so I can provide them with the highest level of care. I want them to feel extremely comfortable and right at home, and I want them to be able to open up to me. And it's really amazing the difference when I have a laser in my operatory and I have the confidence in what they can do for my patients. It's very, very instrumental in allowing me to do that for my patients. We know they're going to be extremely comfortable when we employ the lasers in their therapy. It really reduces their anxiety. A lot of our patients now are familiar with lasers in a lot of other medical procedures, so they're really open and embracing it in the dental operatory as well. For me, I have so much confidence as a clinician knowing what my laser can do. But once I introduce that to my patients, they have so much more confidence in me. So it is a huge trust builder, and it really is a great tool to strengthen our relationship. What I noticed over the years, whether I'm referring a patient to a periodontal office or I'm practicing on my own, accelerated healing time. I used to have patients when I first graduated. I remember, they would come in and tell me I was sore for 1 week after my periodontal therapy, and I continually had to take ibuprofen and warm saltwater rinses, and I'm still sore. It's absolutely amazing what the diode laser can do for the healing process as it's working to remove the bacteria. It decreases the use of local anesthesia. I use so much less anesthesia. Sometimes I only need a little bit of topical anesthesia with my patients when I'm using a laser. We have a lot less noise and undesirable sensory triggers for our patients. We all know many of our patients are very, very high anxiety in the dental office. Our office, we are a very, very laser heavy office. We use them in most procedures. And it is night and day different between a non-laser practice and ours. When we walk in, we have that vibe. It is very calm. It is very peaceful. There's so much tranquility in there you would never expect to see in a dental practice. So we also have an alternative solution for patients when treatment may be contraindicated. We have a lot of those medically complex patients like I was one day and have to be very, very careful about local anesthetics and any type of chemical agent. So now we have this alternative solution, safe for infants, pediatric, and all adult patients. There's really no contraindications to laser light therapy. Pregnant or nursing mothers, we all see the bleeding gums, the puffy, swelly stuff, and they're very protective of their child, and they don't want any anesthesia. They want to hold off on treatment. Now we have a solution. We can help them during this time. Way more precise and conservative versus the conventional treatment modalities. I feel like everything I do in my operatory with my laser is way more clean, pristine, precise than anything I've ever done before I had that in my practice. Let's look at a few common reasons patients avoid the dentist. Time. We are all in this fast-paced world now, and nobody wants to spend the time. And with laser therapy, things go so much smoother and so much quicker, especially with that level of confidence that our patients have in us. We don't have to work through so much of that anxiety that we're dealing with. Sometimes that eats up, half of the appointment just to kind of break through to our patients. So really reducing that stress level and the ease of procedures is great. Pain, we know with the effects of laser, they can provide some what's called photobiomodulation, helping to reduce pain. And the money, the cost of treatment. When I think about patients who avoid the dentist, and I know, I see them come in and they've got a fire brewing and they're just letting it burn, I have a really, really hard time handling that because I know what that's going to look like down the road, whether it means extractions or that they're going to need a full mouth reconstruction, implants, and I don't have the confidence that that's going to last on that type of foundation. Laser therapy is truly a win-win for both patients and the clinicians. I have never had a higher case acceptance since I've had a laser in my hands in my operatory. We have so much more hemostasis and visibility. When I'm doing scaling and root planing, I can see exactly what I'm doing. I can see exactly when I'm done with one area, what needs more time and attention. The patient's more comfortable. The patient's not talking about how they keep tasting blood or they're spitting out the blood. There's so much less bleeding. Procedures are much more smooth, really, really reduces our time in the chair. And patient outcomes, that is something I cannot speak to higher than what I see with the laser therapy. I will never forget the first time I had a laser. I had a doctor I was working with, and he was very, very intimidating. We were sitting there in the morning meeting, and he turned to me and said, "Anja," as everybody was walking out. And I got really nervous, and I thought I was getting to get in trouble. And he said, "You know, I don't know what you're doing in there. I don't know what you're saying to your patients. I don't know how this is all happening, but this is magnificent. What I know about you is you get results." And that did not start happening for me until I had a diode laser in my hand. Higher standard of care. So this is something for me, it is extremely, extremely important. As dentistry advances, I need to stay current. Having been a long-time patient in another realm, it's so important for us to all stay current, because what I want for my patients is I want definitive science, I want fast answers, and I want to be able to provide them with the most current approach and the ability to give them that holistic approach so that we're not just looking at the teeth and the gums, we can better serve their entire body. They're educated now. Today, patients are seeking advanced levels of care. We are in the information age. Everybody talks to everybody, and I want to make sure that I am staying best in class. Providing laser therapy really does increase your patient retention, and it's also very attractive to new patients. It also affirms your commitment to their health and well-being. It really lets them know that you are taking the steps to stay educated and stay current and move forward in your profession on their behalf. This is something that we have printed on the wall in our practice. Superior doctors prevent the disease. Mediocre doctors treat the disease before evident. Inferior doctors treat the full-blown disease. And this is something we always strive for in our practice, is to always be superior. So that is something that being a laser practice has allowed us to do. We also know it's really no longer just about cleaning teeth and creating beautiful smiles. It's really about preventing heart attacks, strokes, maybe dementia. We know we're now finding spirochetes in the brains of those patients with Alzheimer's and dementia. And we have this long list of many other associated systemic complications. So when we tell our patients, hey, we're seeing inflammation, we're seeing bleeding, we're seeing an increase in your pockets, we're very concerned. We have no doubts. We have the technology, we have everything that we can do to save your teeth. That's not a problem. But now, today's world, it is about saving your heart, preventing that heart attack, that massive stroke. And so lasers, we know that we're dropping the numbers from billions to hundreds when we're using those. And we are eliminating the risk of introducing them into the bloodstream. So when I see this picture on the right, the gums that are looking like that, in my mind, I'm having flashes of things like the insulin needle or the kidney disease or the stroke or the heart attack. We also have to take a look at what's going on globally. We have a huge, huge challenge in dentistry. So pain therapy, we've got a huge drug overdose death rate increase in the past 2 decades. So we as a profession have a role and responsibility in creating change for this. Laser therapy greatly reduces the pain, and we don't need the pain medication. I remember having a patient call early on in my years asking for some Vicodin after their periodontal therapy. But you know, not only is it in periodontal therapy, but you know, over on the doctor's side too. Using those lasers, really, we rarely have to prescribe a pain medication. I can't remember the last time we did. So it's a really wonderful way of doing our part in helping this challenge. The other one I would like to touch on is the antimicrobial resistance. This is a really big deal, as we all know. Now it's one of the top 10 threats to the global public health. It's absolutely crucial that we preserve antimicrobials. that are available through the prevention and by utilizing technologies and therapies. So if we catch this periodontal disease early on, we get that patient back to health, it's less likely that they're going to have other issues. When I'm talking to my patients, I tell them, I want to help you with your oral health so that we can take that burden off your immune system so that it can be more effective in the rest of your body and you're less prone to infections and other challenges. ICM MRA, they are calling on us to find alternative solutions to minimize the use. So when we are using lasers in dentistry, we now don't need to use an antibiotic. We never prescribe an antibiotic in our practice. Continually advancing yourself in dentistry is absolutely one way you can make a huge difference in the world. So the more we do for ourselves as clinicians, the more we find answers and solutions, the more we can impact our patients. Expanding our knowledge and our skill sets really, really empowers us to impact our patients, educate them, and really motivate them. We have the ability and the power to inspire them to become active participants in their own health. In our practice, we tell our patients, we really want to help you become the best version of yourself. We work with nutrition, we work with their breathing, really look at the whole entire body, and we empower our patients to make those choices. But we have to have the information, we have to have the education, and we also have to have the technology. So we're going to have enhanced patient outcomes, and that's going to lead to greater satisfaction and fulfillment as clinicians. There is nothing that makes me smile more than seeing a patient with results, or who returns after you've had a conversation with them. Maybe we didn't get through to them. Maybe we had to plant that seed. Maybe it took 3 months of using the water pick and seeing a difference, or making some small changes, and then they come in and we can find out, we can see that we've broken through to them. They're listening. Sometimes providing laser therapy with my Diode with my patients, they turn to me and it just really opens their eyes and they look at me, and they're open to treatment and they're open to information, and nothing feels better to me. I had a patient in the other day, and he wasn't due for an exam, but I was seeing him for my first time. And I was so impressed by the sparkle in his eye and the actions he had taken to improve his diet, to work on his breathing, to reduce his stress, to use his water pick, to take his vitamin D3, all of these things that he has done. And I told my doctor yesterday as I was walking out the door, I said, you have done some fine work on that man. I said he had that niche sparkle in his eye. So it's just a really wonderful way to enhance what we're doing every day as a clinician and make it that much more rewarding. So let's get started. But I want to talk about safety first. I can really appreciate this woman's commitment to safety here at the Atlanta airport a couple of weeks ago. I don't know why we're all out of our PPEs right now, but I do give her a solid 9 for rocking the heels and the cheetah print bag. I think it's beautiful. So safety, if there's one thing about lasers before we get into them, we really need to talk about safety first. It's very important. Lasers are incredible tools. We really have to respect them just as we respect the body. And they need to be used at the lowest power that is going to help us to achieve the therapy that we're seeking. So really the golden rule with therapies, less is more. Before you use any type of laser, you really need to check in with your state practice act to ensure that laser use is within your scope of practice or your licensure. Find out what type of training is required, what level of supervision you need, and which therapies you can provide per your state specifications. Absolutely educate yourself on laser technology and therapy. So once I had my experience with the diode and I knew I wanted to employ that in my dental practice, I did tons and tons of research. So I read through all of the articles, all of the magazines, and I signed up for some training. Once I got my laser, I read through that user manual, and you really need to know your device. Everyone is different. You really need to know the specifications. Obtain the required safety training that your state requires. And also you're gonna get that with BioLays. One thing I love about BioLays is they are best in class at their training and making sure everybody is covered there. ANSI is the American National Standards Institute, sets the general and clinical standards for the safety of all types of lasers. So they're going to provide the guidance for safely using your laser, and they classify lasers according to their hazards, and they set the appropriate controls. So they are in classes. Diodes are class 4. Every office needs to have a laser safety officer. So this is a very, very important piece of the safety here. So any facility having a class 4 laser is required to have an LSO to oversee laser safety in the office. And they really are the only person required to receive the laser training. However, everybody using a laser, involved in the laser, should have this information and know this information. Responsible for monitoring laser hazards and ensure that all these guidelines are followed at all times. They're accountable for making sure every team member is properly trained, and it really can be anybody in the office. It could be the front office. They may even be required to be registered with the state. So again, you need to check in with your state requirements there. And it should be somebody who is knowledgeable and interested in the lasers. Nominal hazard zone is something we all need to be aware of. It's the area where the level of direct, reflected, or scattered radiation poses a hazard to skin and eyes during the high-powered operation. So we know with laser light, we can receive it directly. It can be reflected off a mirror in the mouth or scattered about the room. So it's the area around the patient where all the safety protocols are required. This is device specific. You can find all the information in the manufacturer's manual. Generally, it's typically the entire operatory it's used in, and it's going to determine the maximum permissible exposure value for eyes and skin. It will also require wavelength specific laser safety glasses, proper signage, and the management of the laser plume. Nominal ocular hazard distance. So appropriate safety eyewear is specific to each laser. This is very important. So on the side of every pair of laser safety glasses, it's going to be labeled with the optical density and wavelength, the specific wavelengths it is protected of. So you cannot just pick up any old pair of laser safety glasses and throw them on and feel confident that you're protected. We always have to have this noted on the laser safety sign that's provided by the manufacturer. That sign needs to be outside, right outside the room or on the door. Symptoms of possible eye exposure, it can sometimes be asymptomatic, which is something we all need to be mindful of. So should you be suspicious that you may have been exposed or know that you've been exposed, be on the lookout for symptoms like a headache, maybe a burning sensation, some floaters in your eye, abnormal watering, or a kind of a gritty, sandy feeling. Laser energy, it can actually burn the retina, so we want to be extremely careful. Again, it being direct or reflective exposure. Combustibles. So when you are operating a laser, it is not a time to have a blonde moment. These laser energy can ignite combustible material like oxygen and nitric oxide. So they may be used with proper scavenger and suction techniques, but you really, really need to make certain you're not playing around with that and you have every safety protocol in order. with this. If the patient is on oxygen, you can treat that patient if they're able to be off of the oxygen, and you can leave that tank outside of the room. If they cannot, you are not able to use that laser on that patient. Really avoid laser use with any alcohol-based anesthetics. It's something we don't always think about. The other thing is potentially flammable oil-based lip products like petroleum jelly. So be very, very careful. I always have my patients wipe off anything that they may have on their lips. Only wipe the laser tip with a dry or water moistened gauze. We get in these habits, we get stuck in our routines, really need to take a step back and make sure we're not using any gauze moistened with alcohol. Plume and tip disposal. So 95% of water and 5% particulate matter is what is in the plume generated from the lasers. And what is in that 5%? Microorganisms, organic chemicals, benzene, toluene, formaldehyde, cyanide. And then there's also inorganic chemicals like carbon monoxide, sulfur, nitrogen compounds, and nothing I would ever want to be breathing in. I know that. So it's always required to have a high volume evacuation while you are operating a laser. And it also is going to cool the site as well. So the laser tips are composed of quartz, and they really need to be disposed of as sharps. Before any laser procedure, we have to make sure we're going through the medical history. We know that's so important. Most of the time, there's a reason the medical history that are receiving any type of laser therapy or periodontal care. Assess their current periodontal status, make sure that we know where we're going in, what we're doing, and why. Obtain all the right radiographs, cover our bases with all the diagnostic records, make sure that they have had their comp exam, their soft tissue, and periodontal evaluation. We want to talk to the patient, make sure they completely comprehend and understand what we're talking about as far as the treatment we're recommending. And then we also want to establish that treatment plan, go over the necessary commitments to the time, the costs related, and then what home care the patients are going to need to commit to get those optimal outcomes with their treatment. As far as techniques and protocols, I'm so excited to talk to you guys about the Epic Hygiene diode laser that has been brought to market late last year with BioLase. So this is incredible. When I first was looking into laser therapy, I think when I first graduated school, I had heard a bit about it, but I was quite intimidated, and I just thought, you know what, I'm still digesting all this information. It's all sinking in, and that just sounds so technical and deep and like so much science. And I didn't feel like I was ready for it. But at the same time, I should have been. And just graduating school right now, I would need to be. And I really praise BioLase for coming out with this, because it is the most intuitive, incredible device for hygienists just starting out with laser therapy. So it is designed for hygienists by hygienists. All of the protocols are actually preset, so it's super easy to employ into your practice. We have pocket therapy, which is going to remove the debris for preventative care. Circular debridement, epithelial and granulation tissue removal. We have the ability to treat aphthous ulcers and herpetic lesions for our patients, whereas in the past, we'd have patients ask us to avoid a certain area, or perhaps they'd reappoint their visit. And me, I do want to work on a patient with an active lesion too. So if I can nip it in the bud right there, I have less chance of that exposure. Hemostasis, we have the power to create phenomenal hemostasis for our patients. Their projection that these things are going to lend to your practice, I can't speak more about that. I can't remember when the last time I looked, but if you want to blow your production out of the water, get one of these guys. It's just unbelievable what we can do as far as income for our practice, just being a minimally invasive provider. We've got these designs. Handpiece was designed just to fit the needs of the hygienist. We actually got to pick these up, hold them, give our input. It is an incredible handpiece. The interface is so easy to use. We've got all these presets, pocket therapy, perio, anything that we want to do. We don't even have to overthink about it. So we don't need, to have that intimidation that I once had when it came to lasers. And we have got the best training and support for you, so you're never alone in this. We have all the guidance you need. So pocket therapy protocol, this is a really wonderful technique that I use on almost every patient, and I'm gonna talk to my patients about reducing bacteria in there, so that we prevent anything getting into their bloodstream. We don't need any anesthesia for this procedure. We just go 0.5 millimeter into the pocket, into the sulcus, and we would always watch for any type of initiation. If we see that, we may need to polish first and go back, wipe it on a wet gauze. Just gonna go mesial, distal, buccolingual, circling the tooth, and we're gonna spend about 10 seconds per tooth. It really takes very little time for us. Laser-assisted periodontal therapy. This is something that where when my boss was talking about the results I was getting, this is how the magic happened. So gone are the days where we need to flip that curettage around and accidentally remove some epithelial lining and granulation tissue. We no longer need to rely on our scalers. We can just do this in a very minimally invasive and technical way. Implemented during a periodontal diagnosis. So this is when I'm going to present this to my patients. I'm going to ease their concerns. I'm going to just set the tone to relax. It's okay. It's not that scary. It's not that bad. This is really nothing. And we know that when we do this, we're going to be able to stimulate fibroblasts to generate reattachment for our patients. So we're going to have this optimal outcomes and results for our patients. Perio is this for this protocol. We are going to really literally with this unit, you just simply have to push a button. Perio setting. We've got the option of an initiated or pre-initiated tips with this one. We're going to use an initiated tip. We have length selection based on the axis. We have the 4 millimeter, 7 millimeter, or 9 millimeter length. So if we are going to use an uninitiated tip, you're going to need to do some manual initiation on articulating paper or a wine cork. And we're going to want some topical anesthesia or local, most likely. And then definitely high speed suction for with every procedure here. Angle the fiber away from the tooth to decontaminate the tissue. You're always going to want to angle that fiber towards the target tissue that you're working with. So this is something that is not a hygiene diode specific protocol, but what I just want to share is if you are in an office and maybe your doctor is not a laser doctor yet, but maybe you get an Epic unit and you start working with that, and he sees the benefits that you're getting out of it, and he's inspired. So maybe he wants to get into laser therapy and looks at water lays. So this is fantastic, the things that we can do for our patients. So I like to know whose hands my patient is placed in. So if I have a case that I need to refer my patient to, I can simply send them down the hall to my doctor's operatory and we can get results like this. So that's just absolutely fantastic, builds my confidence in my patients too. Periimplantitis, this is something we see all too often. Us with our diodes, with my Epic, I'm able to prevent this every day in my practice. But in cases where I wasn't able to get there in time, I can send my patient down the hall and look at these results we can achieve with the power of laser energy. Aphthous ulcers and herpetic lesions. So this is something that, it's magic. It's absolute magic that I can do this for my patients. So we're going to kill surface viral microbiology, and it's going to inactivate the lesion and automatically put it into healing mode. We're going to cauterize nerve endings so patients have no symptoms right away. And it's a very compelling introduction to laser dentistry. I had a week this week. I was extremely busy. I felt stress coming on, and I start to feel a tingle in my lip. And I thought, oh my gosh, I cannot. What was I doing on my lunch hour yesterday? I was in my operatory and I was lasering myself, just for that prevention. God forbid that ever happen. But if you do these things for your patients, they will love you forever, and you never know. Are you saving their marriage? Are you maybe they were on a first date, they were going to have to cancel. Who knows what you're doing for them? So when we're treating our patients with an aphthous ulcer, it's going to take us literally 90 seconds. You just hit the setting aphthous ulcer. You're going to use an uninitiated tip, an E44. Hold it perpendicular to the lesion at a distance of 2 millimeters from the surface. You're going to lase the entire lesion, and you're going to go just beyond the borders of it in a circular motion for about 30 seconds. Take 10 seconds to rest. You repeat that 3 times. So we know this is finished when the pain is gone, and you're constantly going to be checking in with your patient. Do you feel warm? Does this feel okay? Make sure they're feeling okay. And again, less is more. When you see that lesion appear white, we know it's probably going to crust over the next day. Hemostasis. So we have patients on their blood thinners or that are just natural bleeders. Who knows what maybe natural supplements they're taking that are thinning out their blood. So we're gonna do this. It's going to we're just going to have the hemostasis setting. Just hit that right there. Heat's going to spread to the surrounding tissues. We may go up, the buccal of 14, 15. Get in there if you have a spot that's really bleeding after you remove a lot of tartar buildup. You're just going to go really slow with the tip after you remove it with the wet gauze. And then finger pressure to complete that hemostasis. So just within a matter of seconds, we can achieve this for our patients. Lots of other things that we can do with our diode lasers. So it's an awesome tool for helping our patients with denture sores. I hate working on a patient when I know that they're in pain, and I'm able to take them out of pain immediately. Patients going through orthodontic treatment, they've got removable aligners that are rubbing, or maybe they're in fixed orthodontics, and we all know how fun that was. Pit and fissure sealants are amazing. So when we laser the tooth prior to etching, it is the most effective way to reduce that microleakage with the sealants. When you do these things for your patients, they will truly see you in a new light. You will become their new best friend. They will look at you differently. They will take your advice readily. So it's a really wonderful tool, again, as I said, to build trust and build that relationship with your patients. So there's a lot of very simple protocols for the documentation. We have some templates here. So it's a very simple thing. You set up laser manufacturer, brand and type, the tips that you use, laser settings. Did you use a continuous or a pulsed mode? Continuous wave or pulsed, energy, power settings, and which area did you use the laser on? Just note that you took your safety precautions and eye protection was worn. Here's an example of pocket therapy. That's right before prophylaxis or periodontal maintenance. Did you use the BioLase Epic Hygiene soft tissue laser, E44 non-initiated tip, 0.5 watts, average peak power. Use it in continuous mode. Eye protection was worn. Patients tolerated well. PostOp instructions were given. Easy templates that you can have in your software. It takes the click of a button. So there's no extra mess or hassle or documentation that you really need to spend a bunch of time on. It's, again, a huge time saver. Aphthous ulcer, here's a chart note for that. Ulcer lesion treated with the BioLase Epic soft tissue laser. Non-initiated tip, 0.7 watts, continuous wave mode, 90 seconds. I always want to include a picture for patients, for insurances. We know, to get that reimbursement for our patients, pictures are extremely helpful. Coding and documentation, you always want to code your laser therapy, because you never know. This is your metric. You never know when your doctor is going to come to you and want to know how many laser assisted periodontal treatments have you done. All of these things, you really want that number in your practice. When it comes to reimbursement, these trends are still evolving. Let's look at usual and customary fees that haven't been updated for the past 20 years. Where insurances are kind of still there with lasers. However, they're seeing the light and they are starting to come around, so there's more and more coverage we're seeing. It's really helpful to provide a really comprehensive documentation and specific narratives for your patients. Always document that it was a medical necessity, and all legislatures and hygienists, we really are all working together to get more reimbursement for our patients on this. And the most common code we're using is D4999, and this is 7465 for herpes labialis, the destruction of lesions by physical or chemical report. And if it's treated without any other procedure on one day, patient calls and needs to come in on their lunch break, we can just do $99, bill it out as palliative care, and most likely it's going to be covered. The 4999, it is going to vary. These fees are going to vary all across the country. I, with my doctor, have a license to play with the fees in my practice. If I want to introduce it to a patient, if I want to give it complimentary, I'm able to do that just so that we can help them through this. So the pocket therapy is typically $30 to $75. Those are a range of fees: 4341 $75 to $225, 4342 $50 to $175. So again, it really varies, and a lot of offices have that sliding scale or a great range of flexibility just to help their patients understand and embrace this laser technology. Evaluations, this is another thing that you can look at for getting compensation. Oftentimes we have our patients back for some, we have them back for a Perio check 6 weeks later. So we have the option of doing something like a 0171 for follow-up appointment if we wanted to, because it's chair time is valuable. We do spend time, and we know we need to be compensated as well. So different ways. We in our office, we really focus on treating the patient. So we're not as focused on that, but there are ways if you're in that space where you need to have income provided. Again, Epic Hygiene, it is by hygienists for hygienists. It is a brilliant thing that we now have access to. Thank you, BioLays. It is very simple. It's highly intuitive and extremely ergonomic for us. It's got the 980 nanometers, so that amount of power is going to aid in the healing and superior regeneration of our tissues. It's a huge practice builder, and it's really easy to integrate into your practice. Peak power, super pulse mode, adjustable settings, and then we know once we have that laser in our practice, very low price point, is just an endless source of production. So it is a small investment in our practice. We consider it just to be another Cavitron or a tool that we really need to serve our patients. Premium constructions, we've got an 8-hour rechargeable battery on that thing. It's going to last you all day. If you forget to charge it overnight, you're still going to have use the next day. So more information, please contact BioLays. They're extremely knowledgeable, helpful. They have the best sales team that is just waiting there for you to answer all your questions and help you through this. And now we'd like to open up the floor for questions.